They may not be administrators, they may not be organizational leaders, they may not feel like they can do something to change the overall systems. We said, well, yes, they can, because they're expert diagnosticians. Each and every one of them already knows how to think about a patient's condition and how to assess it and then how to plan for it. So why don't we bring out this clinical paradigm that again is well known and ubiquitous throughout the world, and use that as a way to engage our doctors and nurses and therapists and pharmacists and other clinicians in thinking, well, how do I use a SOAP format to start to break down some systems based issues that I might be seeing around me, and come up with a plan that I can either embark upon or I can take to my leader or to my other fellow clinicians and see if we can try to start helping our clinicians rather than feeling frustrated and disenfranchised, that they can be part of the challenge in helping us heal the healthcare system. So that's the idea of the SOAP note and why we've integrated into our healthcare summit that's coming up on September 6th, where we're going to have about 15 people who are experts talking about how to use the SOAP note to become a more expert in diagnosing and healing the healthcare system.
Yeah, I think that's the fabulous way to actually tell leaders that how they can integrate the system, integrate this love and compassion through this. And but I would just also want to ask that, how do you plan to measure this, the impact of compassion and love in the healthcare system, that when they provide the patient outcome. So what exactly do you have any tools for that, or how do you measure that?
Yeah, yeah, and I'm tempted to answer this in a couple of different ways. One answer is like I just look at the exemplars, the 10 organizations we've already identified who are already doing this, and we look at what they've done. And really, what they've done is they're not measuring anything new. They're measuring the things that everybody's measuring, that every healthcare system and every clinician wants to improve, which is healthcare quality, healthcare safety, patient experience, turnover and burnout, and profitability. Right? These are the five key parameters that everyone's already trying to improve. Every health system, whether or not they're trying to be compassionate or not, is already trying to improve these. And so these exemplar loving organizations are just looking at these as the end results and trying to demonstrate that based on the way in which they're delivering the care and organizing their approach to the clinicians, that they're improving parameters across all of these five areas.